Back here at home, our never-ending rainfall we've experienced this summer has led to an unexpected public health problem. Tonight, the NBC5 investigative team is digging into Legionnaires' disease.
It is true. Cases are already up, and they are expected to climb even further. NBC5 investigative reporter Chuck Goudie tonight explains how the weather is creating more opportunity for this deadly illness.
Allison, Stephan, the Legionnaires storm is a companion threat to all this terrible weather we've seen in Chicago during July and August. Legionnaires is a pneumonia-like illness from waterborne bacteria that thrives in hot and humid conditions. Sound familiar? There were already more than a dozen Legionnaires deaths in Illinois this year before the heavy rain and high humidity moved through. And once the Legionnaires deaths from the past few weeks are added in, public health experts say the number will be significantly higher.
How often did you ride the main elevators?
It's been 50 years since the mysterious respiratory disease first sickened 200 people at an American Legion convention in Philadelphia, leaving 34 attendees dead. Now we know it's a bacteria spread through contaminated water systems, many times airborne droplets sprayed from fountains, showers, and air conditioning systems. Last month in New York City, a Legionnaires outbreak sickened nearly 100 people and killed 9, with authorities zeroing in on water cooling towers that harbored bacteria in hot temperatures. Here in Illinois this year, even before the weeks of high heat and humidity, Legionnaires' data shows 134 hospitalizations and 14 deaths, the majority in Metro Chicago, with cases and deaths expected to surge this summer once all the health data is compiled.
When things are really warm, and when they're humid, especially like it's been this summer in Chicago, really hot, lots and lots of rain, that really creates a favorable environment for Legionella to grow.
University of Chicago infectious disease expert Dr. Emily Landon tonight says all Legionnaires cases are reported to government health officials, but it's not always possible to determine how or where a person actually contracted the sickness.
There are a lot of ways in which people can pick up Legionella. Sort of a random turning on a hose for the first time that had stagnant water in it and there was a lot of Legionella in it, you breathed it in. That's kind of an unlucky thing. And so it's really hard for us. There's no way, we don't have the public health funding to go back and search for every single case.
Tonight here at Gottlieb Hospital, the NBC Chicago investigative team has learned that a West suburban accountant is in the intensive care unit being treated for Legionnaires. On Illinois' Legionnaires trail the past decade, she is one of more than 4,000 people who have become ill from the bacteria. And while she is still being treated, during the last decade in Illinois, state health records show 312 deaths have occurred from the waterborne bacteria, many in the hot and wet months.
It's absolutely true that increased heat and humidity does increase the risk of Legionella growing in our water systems, and that can be a real problem.
According to federal research, the problem with hot and wet weather is that it produces 3 times as much Legionnaires bacteria once the temperature and humidity are higher than 80. One thing Legionnaires is not is contagious. No person-to-person spread. It takes direct exposure to vaporized water. Back to you.